Many foster children, but not all, have mental health difficulties for which they need clinical intervention. Imagine, you're a clinician or social worker working with foster families. How would you find out which foster children and foster families are likely to need extra support? The answer is to use screening measures, such as the Strengths and Difficulties Questionnaire and the Brief Assessment Checklist. The Strengths and Difficulties Questionnaire, in short the SDQ, is a well-known 25-item screening measure of common child mental health problems. The Brief Assessment Checklist, in short the BAC, is a 20-item screening measure specifically designed for children in care that screens for trauma and attachment-related difficulties. Both screening measures can serve as the first step within a multi-stage assessment approach, wherein children are referred for more detailed assessment if they screen positive. But let's focus on this screening stage. So imagine, the foster carer completed the questionnaire and you as a social worker or clinician compute the total score. This total score represents the total amount of mental health difficulties. But what does this total score actually mean? When, so from which score, do you need to refer the child for further assessment or extra support? In other words, what is the optimal cut point or threshold? And something else you might wonder is it actually better to use the SDQ, the BAC, or maybe even both? The goal of our study was to answer these questions and to provide a mental health screening procedure for professionals working with children in care. To do so, we compared the mental health screening properties of the Strengths and Difficulties Questionnaire and the Brief Assessment Checklist across 3 national studies in Australia, England and the Netherlands. Based on our study findings, we suggest a mental health screening procedure using both the SDQ and the BAC, because it seems that the 2 measures tap into different types of mental health difficulties. Furthermore, our study showed that using both measures increases screening accuracy. Therefore, the recommended screening procedure is using both the SDQ and the BAC, and to refer children for further detailed assessment if the SDQ score is 11 or higher, or if the BAC score is 8 or higher. Do you want to know more? Please read our open access publication in Developmental Child Welfare.